and welcome to this episode of CQC Connect. In this episode, we're going to explore our latest report, which is focusing on the care of people with a learning disability and autistic people in acute hospital. This publication, it reports back on a review that we carried out on people's experiences when they need physical health care and treatment in hospitals in England. This was part of our work to transform the way we regulate sick people. So my name is Marie Cox, and I'm a hospitals inspection manager here at the CQC. I've been involved in the journey of this review and will be hosting today's podcast. I'm pleased to be joined by Fiona, an expert by experience at Choice Support, and Debbie Ivanova, director by experience at Choice Support, and Debbie Ivanova, Director for People with a Learning Disability and Autistic People here at CQC. Welcome and thank you both for joining us today. Let's start by introducing who you are and why this topic is so important to you. I'll start. So as Marie Cox, and I'm an inspection manager. I've been part of the design and I've led this review, and I volunteered to do that because it's so important to me that we hear and understand people's experiences. Fiona, would you like to introduce yourself?
Yes, my name's Fiona. I am an expert by experience with Choice Support. What's important to me is being, sort of patient, talking well, I don't know, being normal, supposedly.
Hello, I'm Debbie Ivanova, and this is a really important topic for me. When we look at care and support for people with a learning disability and autistic people of those services and taking action where services fail to meet the right standards, we know that too many people are in the wrong type of care and their needs and aspirations are not being met. But most people live in the community and we all have access to the same health care and hospital care. However, people with a learning experience is not the same, and the Learning Disability Mortality Review Programme, the LEADER programme, has shown this. So I wanted us to have a real look at how people experience healthcare services, and the first piece that we've done was to conduct this review. When hospital care isn't right, When hospital care isn't right, the consequences can be dreadful for people. And some of you will know about Oliver McGowan's story. I'll talk a bit more about that in a minute, because that makes it incredibly clear.
Great, thank you both. So my is for Debbie. So this report, as we've heard, is based on the experiences of care of people with a learning disability and autistic people in acute hospitals. Could you tell us a bit more about the report and the things it covers?
Okay, so this report came up because, as I just mentioned, the Learning Disabilities Mortality Review, the LEADER programme. Now, that programme was established in 2015, and it reviews the deaths of people with a learning disability in order to learn from those deaths and put that learning into practice. One of those reviews that was held was about the death of a young man called Oliver McGowan. He was 18 years old when he died in hospital. There were a lot of things that were wrong in Oliver's care, and he and his family weren't always listened to, which led to some mistakes. The LEADER report was potentially avoidable. Now, when we look at those LEADER reports and we look at the findings of all of them and the annual report that comes from that organisation, what we see is that there are some themes and trends in the care of people in hospitals. As the regulator for health and social care, we wanted to go in ourselves. Things were going well and what needs to be improved. What we've done is we've used that report to focus on people's stories to illustrate what really does need to change in those services. And the report is structured into 5 chapters. We look at access to care, we look at communication, we look at care and treatment, we look at care and treatment in the hospitals, we look at protected characteristics and equality of care, And the final area is around workforce skills and development. And we've used those stories and people's voice to really help explain our findings and just show how important it is to think about the effect of all of those things on the people receiving that care. So those have come from some of our conversations with you and with other people that we've met while we're visiting hospitals.
Thank you, Debbie. It's good to hear about it in a bit more detail. And before, just a little bit more about some of those overall findings from the review, and then we can think about how that resonates with Fiona's experience. Can you tell us a bit more about those findings?
Yes, of course. So the first area I'll mention a bit around is access to care. And this means not just how you physically get in access to care. And this means not just how you physically get into a service, but how those reasonable adjustments have been made to make it really work for people. Now, those adjustments are going to be different for every single person, and they can be about a whole range of things. It might be about the place where people have to wait when they're waiting, about how messages are given to them or explained, or about the time taken to let people process the information they're given. People have a right to expect that those reasonable adjustments are made, because if they're not made, they can't access the care they need when they need it. What we found was that people have told us it was often these start right from the first point of contact with the hospital. So that's the first area, and there'll be quite a bit in the report about that. Second one I wanted to mention was about communication. When time isn't taken to make sure people's communication and ways of understanding are really tailored to their individual needs, then it's much more difficult and sometimes even impossible to provide that good care that we all have a right to expect. Good communication is key to making sure people are really involved in their care, and people do have that right to expect that communication to really be tailored to what they need. Individually. This is both about how you communicate with people, but also about how you listen and how you understand their communication with you as a member of staff or somebody working in a hospital. This can be tricky, and therefore hospitals need to really make sure that staff have got the tools and the skills to enable them to communicate effectively, to understand, and then to meet people's individual needs. Not listening to Oliver and his mum had real impact for him, and there are some other examples in our report where people would clearly not listen to. On care and treatment in hospitals, people have got a right to expect to be fully involved in their care and treatment. In many cases, this is still not happening because there's not enough listening, communication, adjustments, and involvement. So services really need to make sure that staff have got the time and the skills to listen to people and their families so that they understand and can meet people's individual needs. And the title of this report, Who I Am Matters, really does reflect that. All staff who have contact with people with a learning disability, people need to have that training, to help them to interact appropriately. When I was in hospital, I found it hard enough to make sure people really understood my needs and wishes. So think how much more difficult that is for somebody who does have some additional needs and adjustments that should be addressed.
And for giving us an idea of some of the themes of the report. So my next questions are for you, Fiona, if you feel comfortable, and we're going to talk a bit about what happened when you hurt your finger and had to go to hospital. Is that okay?
That is okay, yes.
Yes, okay. So first of all, Fiona, tell us about how you hurt your finger and about when you first went to the emergency department.
Well, there's a little story there. So when it was lockdown the first time round, I wanted to do some exercise and I had some support, but the swimming pools and the gyms weren't open. So my support worker suggested that I got somebody to help me, and we came up with this idea to do some exercises around my area. So I live on the 4th floor, so I have a couple of stairs, and I got some help with going up and down quite rapidly, as fast as I could, to get more fit. And unfortunately, on the last week before my swimathon, I managed to trip up doing those stairs.
So tell us what happened then.
I got really nervous, really scared, hurt, and didn't really know what happened, and came back into my flat and was shocked, didn't really know what to do, but the people that were helping me also didn't know how to react to my reaction. Because it was at the weekend, I decided to leave it till the Monday to go to A&E. And so I had the weekend to try and survive. I did, however, and I ended up in A&E, whereby people outside the door. I had to wait for probably an hour to be even, I don't know whether they call it triaged or looked at.
Yeah.
And so there was a long wait, and then there was another long wait to get seen. There was a long wait, and then there was another long wait to get seen. And so I was surprised to find out that I'd actually broken it in two places, not one. And therefore, they needed to do an X-ray. Which was in another department of the hospital, which I was directed to. Unfortunately, on the way back to the office that I had to go back to for the person to realise. Unfortunately, in the end, I think somebody found me and directed me back. So then in the X-ray department, I went in and they looked at my finger and were surprised to see that I wasn't emotional or annoyed or angry or whatever you like to say when you're upset and in pain. And I said, I'm drugged up with painkillers to pain due to having epilepsy. And so then she took the X-ray and said it's broken, and I was rather pleased after that, because that meant I felt like it was okay to be in pain.
Okay, well, why don't you tell us about the things that went well?
Told it was broken, I was rather pleased, and I got taken to the computer and told to come back in 2 or 3 days to get it looked at with a specialist. And then they looked at it and discovered that I might have to have it operated on, which was a bit of a shock, and didn't really understand it when they said operated, and then they told me at the time that I could be awake and you could have it without the injection, so that you could have half the arm, so that you don't feel it, and or you could have the whole arm. And I went, well, of course, I think I want the whole arm, thank you very much. Which unfortunately meant afterwards I couldn't feel my arm at all. But through the process of going in for the operation, I was waiting around trying to understand how long. So you had to go at 7 o'clock in the morning. And then wait until you were served, and do all these things like undress, get it seen to, and then wait for them to come for you to be. But what they, I feel, they didn't take that there's processes that you need to go through before you go to the operation, room. So these things were, don't eat or drink before something like 5 o'clock in the morning. And so, and if you have to take medication, have vision. So that's fine. I did all that, and I got changed and ready. And they suddenly came to me and said, "Have you been to the toilet?" And I said, "No." And they said, "Well, you need to go for a pee before you go in." And I was like, I don't understand why that is. And they didn't tell me I feel they didn't tell me for an hour or so. And I don't, what's the word, pee on command. So I had to sort of try and think of how to do it. So anyway, I spent about 2 hours waiting for this process to happen. And it turned out it was because if you're pregnant, they can detect it or something.
So think about the things that you've just told us, Fiona, about when you went to the emergency department and what were the things that went well, and then coming back on the day of your operation. Thinking about those things, what do you think were the things that could have been done better? So what things were better? So what things would have helped you to understand what sounds like quite a lot of demands?
Well, it's a tricky situation because you're in A&E, which is a very busy, and there's lots of people around. Expect somebody that's a stranger to know that you have difficulties necessarily. So I can't really understand what you do. However, I would prefer to be told that I waited in a waiting room, told that you'd either be given a piece of paper to say 1 to 5, this is how it's going to happen, or you'd be taken to a side room and just said, look, you're going to have to wait. This is what's going to happen, and this is how it works. It's going to happen, and this is how it works. And then go back to the waiting room if need be. So it's just putting that little bit of, I mean, extra time would be great, but that's not really possible. I think that's a reasonable adjustment. I'm not sure.
Being given the time to help you to understand things in the same way that everybody else would be able to understand what's going to happen.
Yes, I think so. However, it can be tricky to understand that I have a disability or a learning difficulty. So I understand that to a certain disability or a learning difficulty. So I understand that to a certain extent. But if you say it to them, so I'd say I got a learning difficulty or something like that, and maybe even have, I think I had that sunflower strap that's been around you have a difficulty, which helped them to a certain extent, but not completely.
Okay. And so did you go through the visit to the emergency department and then back on the day of your operation on your own, or did you have anybody with you to help?
Well, on the first,
or did you have anybody with you to help?
Well, on the first, on the A&E situation, I didn't have anybody to help. And then, obviously, I think it happened on a Sunday. My mum didn't come back home until, say, Tuesday. Then she started to come with me to the appointments, after which, so we went into the hand specialist, and Mum was with me. And then also I had to move back home to go through the process.
Were you allowed to have somebody with you when you went in for your operation?
What happened? No, I was taken by my mum in her car and taken to. She showed me the door where I had to be. And then I was unable to have anybody with me after that. So I had to go through this massive operating looking waiting room and say to the receptionist, I've done this in my paperwork, and then wait on my own. This in my paperwork and then wait on my own.
And what was that like for your mum?
Nerve-wracking. I think it's unfair for anybody not to have anybody to help you as you go through these painful situations and ongoing care. But I think it seems more difficult for a parent to understand that their child who has a learning difficulty, who doesn't understand the society as well as Joe Bloggs, it makes them more nervous than normal and anxious and upset because it's not right.
Yeah. So thank you, Fiona, for talking us through your time in hospital when you hurt your fingers. It's really interesting to hear about these things from your perspective. And of course, the purpose of this whole report is to talk about the experiences of people when they go to hospital. If it's okay, I'd like to ask you to think about your experiences in hospital and to think at the same time about the things that the report says. Obviously, you can pull on more if that helps you to think about things.
Thank you.
So just as a quick question, I suppose, tell us what you think about the report and whether you can see things in there that have in common with your time in hospital.
Well, there's a few things that it's helpful to understand that there are people that understand us and want to help us more. And I think it's good to have examples of other people's experiences and to see that there's other people out there that are struggling with these situations.
So think about what Debbie has said in terms of communication, for example, and your experiences of communication when you've been to hospital. Do they sound like something you can relate to?
I can relate to the mistakes and I can relate to positive. But generally, when they're positive, I have to have somebody with me, which is unfortunate. Not all the right times can happen.
Yeah.
Not all the right times can happen.
Yeah.
So I think it's really nice to be accepted as your average person. However, it's difficult to communicate that cognitive processes are damaged when I am relatively okay with conversation. Because what happens to me is it takes me time to take names of conditions or processes that you have to go through when you go to a hospital appointment. And that's where this report helps for examples of difficult and how they could change them.
Sure. So one of the things that you've just said there that I'm thinking about is that you're more likely to have a positive experience if your mum goes too. And we talk in the report about or supported, yes. And we talk about in the report the support when they go to hospital. Is that the type of thing that you're thinking about? One of the ingredients of a positive experience is including your circle of support to help you.
Yeah, definitely. Okay. I think it's either tends to be my mum, but I've since living in my independent supported flat,
Yeah.
I've tried to get other people from Choice Support to help me with those processes. So they've taken over mum's interaction with that type of.
So mum can concentrate on being mum rather
Exactly.
than being on.
Basically. But it doesn't always happen.
That's a mum thing. The mum thing.
I'm
Okay.
discovering that.
All right, Fiona. One of the things that we talk about in the report as well. One of the things that we talk about in the report as well is about how a person's learning disability, or about the fact that they are autistic, can overshadow any other needs that they might have. Can you tell us about when your hydrocephalus meant that staff found it confusing which of your hands had the broken fingers?
Yes, so I have the left hand side of my body is naturally formed. The right hand side of my body, my toes and my hands aren't, so I can feel things, but I can't necessarily. So on my right hand, I can squeeze it like a fist, and I can take it out like when you have 5 fingers and 1 thumb, but it's not straight. So I can't get it to be straight and natural. I can't get it to be straight and natural because it goes it's a little bit like it's over jointed, do they say?
Okay.
And so when people, so I can shake somebody's hand, but if you hold my hands up, you can see a difference.
So when you broke your finger and you went to the emergency department, what difference did that make?
Well, they were more concerned about my right hand than my left hand.
Your right hand being the one that's affected by the hydrocephalus. Okay.
Yeah. Because it looked like I have one finger that goes backwards more than the others. It looked like it was that one rather than the left hand.
The opposite hand.
Yeah.
Okay. Okay. All right. That must have been frustrating.
It was, yes, very. But I mean, having to explain that you have hydrocephalus and not everybody, is knows that information. It's quite difficult to say in one sentence. So it's a bit tricky to. It's I believe people are less likely to have it today than when I was born.
So it takes some time for you to be able to explain to people the difference that makes.
Yeah.
Okay. All right. Thank you, Fiona. Debbie, could you talk to us a bit more about the other themes and findings in the report?
Yes, of course. And I'm really pleased that Fiona's been able to talk us through that so well in terms of her experiences, because I do think it does reflect the themes that are in the report. And I think I want to kind of throw out at this point maybe a bit of a challenge to everyone who's listening, because I think we need to really recognise the kind of things that Fiona has talked about. So we need to recognise that every person is going to be different. We need to respect that individuality. And then we need to react differently. And I want to talk a bit about that in terms of protected character. Staff didn't properly understand protected characteristics and the quality of care. And there was a tendency to focus on one aspect of the person, a bit like Fiona was saying around her hydrocephalus. And that sometimes would be a person's learning disability, or sometimes actually not recognising that protected characteristic. Often autistic people were not recognised as such and their needs were ignored. So there's that recognition first that's really important. Then that has to lead into a respect, because people have got the right to expect the care and treatment that meets all of their needs. And the specific protected equality characteristics of autistic people and people with the characteristics of autistic people and people with a learning disability will also be about age, race, sexual orientation, and those often risk being overshadowed because staff lack knowledge and understanding about inequalities overall. So providers need to ensure that staff have trained all of a person's needs are met. So that takes us into the third bit, which is about reacting differently. And what we also therefore talk about in the report is about workforce skills and development. We did find some great practice from some staff, and particularly from some of the specialist staff, and some of those people who had really good experience of people with a learning disability or autistic people in their own lives. But we cannot expect that just those specialist practitioners and teams have sole responsibility for that work. So they need to be able to focus on improving everybody's experience and knowledge, so that all people who come through the hospital, whether that be on a weekend when they're not on duty or an evening when they've gone off, get that high quality level of care. So people have the just specialist practitioners or teams. The providers, therefore, so those people who run the hospitals, must make sure that all staff have up-to-date training and the right skills to care for people with a learning disability and autistic people. And that also means the right skills to be able to communicate, to be able to respect, and to the whole piece, the whole way that people are interacted with.
Sure. Thank you, Debbie. Thanks for that. It's really helpful to understand that outline of the themes that are related to protected characteristics, equality of care, workforce skills. It sounds from all of those things that although we found, and we have found, some positive things in the work, there is still a lot of work to be done to improve around these. So tell us about, from your experiences, the difference it makes when staff know how to care for you properly.
I'm happier. Life is much more normal. And it's not me getting frustrated or angry, or it's about the other person realizing that I am enthusiastic, got a bit of a sense of humour, and not to take anything too seriously, although things are serious. I think it's all about taking your time, maybe saying it a little more basic than the average person.
Those are the things that have happened when you've been cared for by staff who have the skills to do it properly. Are those the sorts of things that you see?
Yes, they are very much so.
So thank you for that, Fiona. That's really, really interesting. Just off the back of that, my final question for you would be that if you had a magic wand and acute hospital settings, what would it be?
A smiling face, to a certain extent. And I think it's just to say, hello, how can we help you? I don't really know. It's tricky because it's such a pressured job to be in a hospital that I think it's just about, if you say you've got a condition, that you can see that they understand, and there's a certain amount of compassion, I guess, rather than I'm frustrated because this person is too slow for this process. It's more like that, really. But it's really difficult to say because of how pressured the job is.
I think you've been very, very generous in your analysis of that. Actually, I think one of the themes that I can hear from the conversation that we've just been having is about the one thing that's really important. One thing that's really important is taking the time to hear and understand what you need. Would you say that is?
Yes, definitely.
Okay. Thank you so much for that, Fiona. It's really interesting to hear about all of these things from your perspective. And it's the interesting thing about this report is that it is all about the experiences of people. So this has been a really interesting discussion, and thank you for joining us and sharing your views with us today.
Thank you for including me.
You're very welcome. So you can find our report, which is called Who I Am Matters, on our website, and the link for that is in the podcast description. You'll also find some really helpful supporting literature there too. Thanks to those listening. Keep up to date with all of the work we're doing to transform the way we regulate services for people with a learning disability and autistic people through our blogs, our digital engagement platform of this podcast. We've got lots of CQC podcasts coming up, so look out for those soon. Thank you.